everybody. Welcome back to the Incubator and Neonatology Review podcast. We are back with Rooney Toms. Rooney, how are you?
I'm well. How are you, Ben?
I'm
Yeah,
good.
doing okay. Excellent.
We are reviewing cardiovascular topics. I think today I'm gonna let you take it away and tell us what we are covering.
Yeah, so we're going to take on a couple of physiology concepts.
Okay.
A couple of physiology concepts that we frequently see and have to address in the NICU, but not necessarily work with all the time, right?
Okay.
So, so I'm just going to scroll down to one here, because the one thing that I wanted to start with is kind of we hear a discussion frequently. What kind of being on CPAP, or CPAP on the ventilator, how does that affect your heart?
Right.
Okay. So we know that, or we kind of have a sense, I've been told, that being on positive pressure ventilation is actually good for the heart. Okay. How do you describe that in a physiological way? And
Right.
that's kind of one thing I wanted to go through. Your mouse is so sensitive.
First of all, don't blame the mouse, but there you go. Now you'll be able to feel it a bit better.
Oh yeah, okay, that's a little better. Okay, never blame the mouse. Okay,
the cardiologists are such snobs. Even the mouse is not good enough.
Yeah. Anyway, so like I said, increase in mean airway pressure is beneficial to the left side of the heart.
Right.
We know as neonatologists also that increase in mean airway pressure has a negative effect on the right side of the heart. Okay, so we're always kind of dealing with that conflict right there. But let me kind of walk people through why it's beneficial for the left side of the heart. Okay, and the reason is really practically you're reducing the afterload of the heart. Okay, and how does that actually happen? So you have to kind of talk about the transmural pressure, and the transmural pressure is decreased. So if you measure your radial artery pressure right here, then you measure the pressure inside your artery as compared to the ambient pressure, okay, to the pressure around you. But if we were to put a catheter and measure the pressure in the left ventricle, that left ventricle pressure is related to the interthoracic pressure. Yeah. So between the inside of the heart and the outside of the heart, then you're actually comparing the inside of the heart pressure as compared to the interthoracic pressure. That's kind of the difference.
And that's where ventilation would make a huge
That's where ventilation actually comes in. Yeah, exactly. Because then all of a sudden you actually increase the pressure in your lungs, right? Or in your interthoracic pressure, and therefore actually reducing that transmural pressure.
You can either push on the left ventricle, or it can actually almost suck the left ventricle out and open it up even more.
Correct. Wow. Correct. Yeah. So, so again, this is basically describing the kind of the transmural pressure, which is intravascular pressure minus the kind of pressure outside, which in the left ventricle is the intrathoracic pressure, or the pleural pressure. So let's start with just kind of a simple model right here. Here you see the ventricular chamber pressure if you were to measure this, and you have your extra cavitary pressure or your interthoracic pressure. So your transmural pressure is your left ventricular pressure minus your interthoracic pressure. The interthoracic pressure includes all parts of the interthoracic aorta, the ascending aorta and the descending thoracic aorta. So the second you actually leave your left ventricle, you actually start having your interthoracic pressure. Okay, so the aorta is in the thorax, not in the left ventricular, right? So that's why you're comparing this pressure inside your left ventricle to anything external in the interthoracic cavity. Okay, so let's just use a couple of examples. So in a normal, calm breathing person, your thoracic pressure is minimally affected, right? So you're breathing. So you can kind of say like your interthoracic pressure is roughly around -1, 2, 3 maybe, or maybe a little positive here and there, and then you're roughly around 0. So your left ventricular pressure minus your interthoracic pressure is roughly 120 if your blood pressure inside your systolic pressure inside your LV is 120 minus 0, which is basically equal to the outside, right?
Mm-hmm.
So normal negative pressure ventilation doesn't do a whole lot. However, if you were to take these deep breaths where you really increase your negative pressure inside your intrathoracic cavity, supposedly it's called the Miller maneuver. I don't know why Dr. Miller got the term for
Everybody's always trying to
breaths.
squeeze their name into something, right?
Exactly. So, but anyway, so imagine if you take a real deep breath and your intrathoracic pressure becomes very negative. So negative, say in this case, negative 20. That means that you take 120 for your transmural pressure would be 120 minus negative 20, which is basically you add those two together. So then you have a transmural pressure of 140.
Mm-hmm.
Okay, so that means that the pressure inside your left ventricle of 120 then needs to pump against the pressure of 140.
Yeah.
Okay, so you're increasing your afterload. So the left ventricle has to pump harder. Okay.
It's so interesting how these mechanisms are doing the same thing effectively, making the work of the left ventricle so hard, but in such different manner.
Yeah, exactly.
Right.
And I honestly, I don't think this is intuitive when
No.
you're at the bedside, right? So you have to kind of have been tortured by a cath cardiologist for a little while before you kind of find this stuff intriguing, you know. So positive pressure ventilation. So even CPAP actually does this. So imagine if you then take away the negative pressure ventilation, where we actually suck air into our lungs, but we're actually now forcing air into our lungs.
Yeah.
So you have a positive pressure in there. So if we were to calculate the transmural LV pressure, you take the left ventricular pressure, which is 120 minus positive 20.
Yeah.
Then that gives you a transmural pressure of 100.
Right.
So practically you're lowering the left ventricular afterload. So the left ventricle of 120 pressure now pumps against the afterload of 100 millimeters Hg pressure. So this is,
and the direction matters. It looks like, because in the previous graph that you showed us, you see that negative pressure ventilation is almost like you trying to go in a certain direction and me pulling you in the opposite one. Mm-hmm. And in this case, where you have positive pressure ventilation, it's you trying in a certain direction and me pushing you in that direction, which explains why the transmural pressure is actually lower.
Exactly. And this is an example for, say if you have a baby with HIE or a baby with cardiomyopathy that comes into your unit, and the discussion is, should we put this baby on the ventilator? If the left ventricle has decreased function, then knowing that putting that baby on the ventilator will practically result in afterload reduction and help that left ventricle. Okay. However, we all know that intubating a patient with decreased cardiac function can always be tricky.
Yeah.
So cautious with sedation and all that stuff. And but again, it will ultimately help that left ventricle for sure with afterload reduction. And that basically wraps up this concept.
Very cool. Very cool. All right, Renee, we'll see you tomorrow for more.
Excellent. Thank you.